get-go.
Okay.
Hi, welcome to the Best of Sherwood Park. I am so excited to have Shani DeShield here. I was delighted to meet her at a network function, and I immediately reached out to say we need to let our community know about you and your services because of where our healthcare system is right now and the incredible resources that I know that you can share with us and your insight into the world of health and our and in Alberta. So Shani's going to talk to us today about her passion project and how she turned that into a business. And I want you to just start telling us all about you. Where did you get started and what created this incredible opportunity for you?
Well, let's see. I could go on for a long time, so I won't. But I had some difficult health experiences in my family and some losses myself as well. In my younger years, my mom passed of cancer when I was 3. I don't remember much, but definitely had an impact on my life. And my father always had health problems from as far back as I can remember. I think I was in first or second grade when I knew that he had some health issues. And then my first child I lost as well. After a really difficult pregnancy, a placental abruption, so an emergency C-section, and then he was born with a heart condition and didn't survive the open heart surgery at 10 days old. So all of this kind of gave me different viewpoints of the system, and what worked, what didn't. I had some really frustrating experiences not being allowed to be with my son when he passed, not being allowed to see my mother. I don't remember that, but my older brother does still. He was 10 when she passed, and he wasn't allowed to see her, nor was I, for weeks before she died. And things have changed since that time. I'm in my 50s, so it's been a while, but it still has a long way to go. So I just kind of always wanted to make a change and see people have the right to choose what they wanted to experience in their life and in health. Even if we have poor health, we still have choices. I worked in healthcare. I went back to school in my late 30s for nursing,
Okay.
and did that for, I don't even remember now, probably just 12 or 13 years as a nurse, and then went back to school as a nurse practitioner. Um, and when I was a nurse, I worked for a while in the US because we lived there for my husband's work at the time. And I saw good and bad in their system. And thought, okay, when I go back to Canada, I grew up in Canada. Canada has free healthcare. It's great. You don't ever have to pay for anything. So moved back here and started working in healthcare here and went, whoa, where's this amazing healthcare that I thought I used to live in and experience? And there are great things that it's fabulous that we can say, oh, my little one is sick. I need to go to the doctor
Mm.
and go and not have to get out your credit card to pay for it. That is wonderful. Um, but when you have something wrong, uh, you know, how do you get it fixed? How
Yeah.
long do you have to wait? So I can't fix all of those things, but I wanted to help people to be able to navigate all of that, and to advocate. I think that's probably my biggest experience in life for myself, my family, is that I'm not a fighter in everyday life. I'm very can be very timid, very quiet. When we go to those networking events, I usually stand off in a corner and wait for somebody to talk to me. I'm not that person. But when it comes to your health, uh, I'm a big advocate for people. So when I first started Manchester Rose, my
Yes.
business, I was still a nurse, and it was beginning of COVID. I had lost a job. Didn't know that I wanted to go back and work for anybody else because it was just too frustrating. I had to follow everybody else's rules, and again, I'm not a rule breaker, but I just felt trapped by that. And my oldest son, at the time, was also kind of in limbo. He used to play for the Eskimos CFL team. Now they're the Elks. He
Yeah.
used to play for them, and when COVID hit, they weren't playing. So he was kind of in limbo too. And he said, "Hey, let's like, why don't you just like start a corporation and do something for your, nursing?" And I had worked previously in the States in elder care and hospice and palliative care in the home. And some of how hospice and palliative care was done here as well, very much focused on either going in somewhere at the end of life. That frustrated me too because not everybody wants that. Some do, but not everybody wants that. And not everybody finds that comforting or peaceful. And I had experienced a lot of sounds strange to a lot of people, but a lot of beautiful deaths
Mhm.
in my experience. And I wanted to be able to offer that to people. But as a nurse, we tried starting a company doing that, and we just got a lot of pushback. Families wanted the experience that we were trying to offer, but their doctors were telling them, you can't do that at home. It's not possible. And
Right.
what do you mean it's not possible? I've done it for people. It is very possible, but without my ability to be the one prescribing medications for comfort and make those kind of decisions, I couldn't do it. So, and we all know COVID changed a lot of things for people. So during all of this, our company kind of got pivoted a little bit to doing a lot of more healthcare staffing for facilities, senior care. Um, so we did that for a while. We still do that a little bit. Do some home care. We're not solely a home care company because we have many hats, I say. We kind of do whatever somebody needs if they reach out to us and they want our help. Um, and I've told many of my patients over the years and their families, if I could do this for free for people, I absolutely would because it's my passion I'd go and sit with you at a doctor's appointment and listen for you, be those extra ears, help you advocate for yourself, anything that's needed. But I have to pay bills too. So, so I can't do it for free. Excuse me. So, uh, thus the business, Manchester Rose. And then I decided I needed to still be able to do more. So, crazily decided to go back to school, which was quite the experience. I actually went away to school, so
Oh,
left my husband for a year. I did the first year at home, then I left for a year, went away and stayed at a friend's place in their basement, in a little nice basement suite. Felt like I was in a dorm room away at college, and finished up my degree. And then came back and have started up my own nurse practitioner clinic. And that is where we're at now. So we still operate the rest of the business as well.
mhm.
Have a lot of great people helping me with that. But the primary care clinic is where my big focus is right now, and it's primary and preventive care. I didn't want to lose the primary care because people need to know that's what it is.
Mhm.
But the preventive for me is a very big focus. So that's why the name Manchester Rose Primary and Preventive Care. And we are in Sherwood Park. That was really important to me because I live here. My daughter and her family lives here. Um, and there's a lot of need here. You just have to go on some of the Facebook pages for
Oh.
Sherwood Park and Strathcona and see, especially women, families for sure, but especially women.
Mm.
Does anybody know anyone that's taking patients? I really want a female provider, and I thought I could be one. So
Mhm.
I just figured let's do it. So
Yeah, that is brilliant. First and foremost, I am so sorry. The losses that you've experienced are
thank
just
you.
heartbreaking, and especially for your son, I can't imagine.
Mm,
But thank you for sharing that. And isn't it always in, these moments of hardship that we find
mhm.
our passion?
Yes.
So you, like me, if I could work for free, I would because I just love what I do. So it is lovely that you could go back to literally a passion and find your fuel for what you do every day.
Yes.
I'm curious because I really need to understand if for myself, and I'm sure I'm not the only one asking these questions, difference between a nurse practitioner and a GP and how what you can practice and what you can't. And are there any?
Sure. For a GP, most of us know what they do. We've all, at least when we were younger, maybe not so much now, but at least when we were younger, had a GP. Fabulous uh, GP that I had when I lived in Ontario was a young mom. Pretty much was so amazing. She knew our family well. She knew when I walked in if I was having a good day or a bad day and would listen. And um, interestingly, I found out later she used to be a nurse.
Oh,
So, which kind of triggered me to, oh, you know, maybe that's why I really had such a good experience with her. But she was amazing. And I think to me, a GP. They're a doctor like specialists are doctors, right? So many anesthesiologists are doctors. They all do the same education at the beginning and then they go and specialize. A GP does the education, the schoolwork, then they do their residency, internships, uh, and they are trained for primary care to help you be the entryway to the health system, supposed to bring everything together so we don't have all these silos. That's the goal.
yes.
Um, and really, a nurse practitioner who is trained for primary care, that should be the same thing, and it is, but a lot of places haven't recognized that yet. Thankfully, Alberta has now, and we are trained differently, though. We don't do 4 years of school, a bunch of years of residency, and then practice. We
Mhm.
go to school for nursing. Many people practice a lot longer than I did. I was a little bit late to the party
Okay.
in life, but a lot of people start nursing in their 20s.
Right.
And they practice for years and years and years, and then they go back and they get extra education
Mm.
and many master's programs. That's what I did, just because I didn't want to go back again into a PhD at my age. But a lot of people will go on and get their PhD as well. But once you have your extra education as a nurse practitioner, your scope expands, and now we can do the same as a GP. We can order tests, interpret the tests, diagnose disease, help you with your preventative care, all your preventative screenings, talk about family history, refer you to specialists if need be. Um, there's actually more we have in our scope that we're not yet allowed to do, but that's the same for GPs right now. It's not any different. I don't even know how long ago it was, but GPs used to be able to do blood work and vaccines and everything under one roof, which completely makes sense to me. And that's what I would love to do. But right now, that's not permitted. You know, you have to go either to the pharmacy or to public health for your vaccines. And you have to go to, well, it was Dynalife to APL labs now for blood work, unless you're doing private pay things. So it's a bit different, and I'm hoping that eventually it comes back to everything under one roof because it just makes sense. How many of us as young moms have been at the doctors or at the nurse practitioners and they say, okay, now it's time, little one needs these vaccines, and then we have to go home and book another appointment and take more time off, or we forget and things happen. And so it just makes more sense for everything to be under one roof.
Yeah, no, absolutely. And you certainly see that in healthcare in the US, where I've got many friends there that have, you can go into one facility and
Hmm.
everybody works together. Although I love the synergy that we have out here, the synergy building,
Yeah,
where, they've tried that concept, but it still is separate businesses. They're just under one roof.
right.
But nobody really, like the physiotherapists don't talk to the doctors, then the dyna or the imaging, they still wait for the results to get back onto the net care system. So
Yeah,
it is still disjointed, but we're all under the same roof. But you do see a lot of synergistic collaborations in the
yeah,
US where you've got even specialists that work under one roof.
yeah,
And you now can see a GP that refers you over to a gastro or a heart specialist, which is
yes,
amazing. And I mean, I'd love to say that our system is proactive, but we're still so reactive and getting, unfortunately, the gap between proactivity and reactive is just so great,
yes,
especially since COVID. And that's what I see the biggest problem in healthcare is we're just reacting to
yeah,
whatever's coming up. So as my job, in the health and wellness, it's like, how do I keep my people out of that
yes,
system? And with you, again, you're looking at primary and ideally proactive health, where you
yes,
can look at things more so than just being, okay, now you're in a situation where we need specialists. We need more than just what you can provide from a general perspective. So it's good to know that we have, like, when we talk about nurse practitioners, that there's no really distinguishing factors that I would choose a nurse practitioner over a GP. So that's lovely.
right.
Now, how does that, because I know that there are some stigmas in the healthcare industry. So, how does that translate for specialists? Are you looked upon when you're referring your patients to specialists? Do you get the same treatment as GPs?
Um,
And have you had any issues?
I don't think the issues that I have had are directed at me as an NP. I think
Okay.
it's honestly right now, I think it is the system. It's just broken. Um, but I say that not being 100% sure because most of our referrals are now, unlike previously, are all done electronically. That's the way
Mhm.
the system is set up. So if there is somebody that's got an opinion about me as the one referring, I don't know that because they don't put it in writing.
Sure, of course.
So it's
Yes.
a little bit different than when I, as a nurse, used to call, a specialist, and you would get some that were very appreciative of the information and they appreciated your connection with patients. And there were others that just looked down on you.
Mm.
So I'm sure that's still the case. And sadly, I will say often with women as well, with male providers, even as GPs or specialties, and then a female nurse practitioner. There are males there too, but I know as females, you do sometimes still get that the gender difference can play a factor. But I really think it is the system more so. The system's built of all these rules, and if you don't meet all the criteria to make a referral properly, it can just be refused. And so very frustrating.
And really, that's what you're talking about when we need to be advocates for our
Yeah.
own health. And we will get into that because I really want I really want the people listening to the podcast to understand what does that mean. And that doesn't mean that we have to stand and pick it outside of a practitioner's door. So we will get to know a little bit more about that from your perspective, right, like right in the system because
Yes.
I do appreciate that we need to have rules and we need to have standards and we need to have practices. I do
Yes.
understand that, but sometimes we are chasing our tail and it just feels like you can't get anywhere, and that's where I think it would be really helpful to get a really good understanding of why that these things are coming up for us. But let's talk about specifically your practice,
Mhm.
um, your ideal patient. Like tell me, because I know that you're accepting patients, new patients now. So
Yeah.
tell me about what that looks like for you at Manchester Rose.
So yeah, we are absolutely accepting new patients and will be for quite a while. The funding program that I became a part of here in Alberta just started about 18 months ago. Um, and I'm happy for the program. It leaves a lot to be desired for most nurse practitioners. So there's a lot that we are hoping we can change through our advocacy as NPs. But they do require us to have a roster of 900 patients. And I'm not anywhere close to that yet. So I have lots of space
Okay.
for people. Uh, my ideal patient really is anybody that wants choice and wants a partner that in their care. I'm not here to tell anybody that I know everything, far from it. I do tell my patients I'm a big researcher. If I see a result that just doesn't make sense to me, I don't just say, not a big deal, nothing else is wrong. I actually like go and research and try to find answers. And if somebody comes in and all their labs are normal, but they have been suffering, well, there's something going on. And maybe it's not a medical issue. Maybe it is mental health or emotional health or stress or financial stresses. There's so many things, but they need somebody to work along with them and figure things out. Um, and I think too many people go unheard.
Mhm.
And that's what I want my patients, whoever they are, to know that they can come and be heard. And so I just want somebody who wants a partner. If you're coming to me to get all the answers, probably not the right person. I have I have my education and I will research. But I'm sure there's many other providers out there that have lots and lots of years of experience and could probably give you an answer quickly if you can get in to see them. But I really want to partner with my patients, their families, and be there like my GP that I talked about was for me. I recently reached out to her to thank her because that's where my uh, I guess my model for my own care came from that and one of my preceptors in school who was very much like that same GP. But she was a nurse practitioner and just people who sit down with you, show you the labs right in front of you, discuss what it means, and not just the ones in red. We all know the red. We all go, oh no. But what about the ones that are black? What about the normal ones?
Yeah.
Are they normal? Are they good for you? So, I just partnership, I guess, partnership and choice. And even before the primary care in the home care and everything, that's our motto is to provide people choice. So
Yeah, I love that. And really, those are things that we think have been taken away from us because
Mhm.
we are desperate to find answers, and we're taking whatever answer we can get first and foremost, so that that we feel like we're making a difference for our own health, especially if it's acute.
Yeah.
But I do love that you've got lots of room, and I can't imagine that it won't be but a few months from now, and you're like, sorry, I'm full. So is your load as a practitioner, well, you said 900. If I'm not mistaken, do GPs, are they allowed to carry a larger client load?
Oh, they can carry a larger one, but they're only required to carry, I believe their new arrangement is for 400.
Oh, okay.
Yeah. Yeah,
Okay.
and we can carry a larger load as well. Um it's we the way the funding model is GPs are funding. I think they have a couple new ones, so don't quote me on that. But the original was a fee for service, right? So you go in and see them, they bill for that visit. And because they're trying to make money like we all are, they are trying to get through a lot of people in a day. And so you get the only one problem per visit. And I think that also came because there's so many people looking for care. So that makes sense. But our program is different. It's a set amount that we're paid monthly, somewhat like a salary, though it's not a salary. We're like independent, we're business owners. But we get paid a set amount, and uh, in your practice, you have to have this many patients rostered that are your patients in order to keep getting that same amount. If you get more than that, you don't really get paid any extra until you get a lot more than that.
Got it.
So you've got to get a certain number above that before you get any extra funds.
Okay, well that makes sense. So let's walk this walk together. I go in just for my annual checkup with my GP, with my NP. You each get paid for that visit.
Yes.
And so whether I'm coming in for a cold or whether I'm actually coming in for a physical, in your as an NP, you get paid one number per month, whereas the doctor, do they get paid a different amount if I'm coming in for a cold versus a longer appointment that may be a physical?
Yes. I don't know all about their billing, but I do know they have different complexity billing. So if you're a more complex patient, they'll get paid more. Um, they do, I believe, still get paid for virtual. I'm not sure about house calls anymore. That was going up and down kind of throughout COVID.
Yes.
Um, they will get paid if you go back that same week. They get paid another amount, right? If they call you on the weekend, they get paid another amount. So it's each visit kind of a thing. And with us, it's just you're on my list, Kim. You're now my patient. So that's one of my 900.
Right.
That's it. And I'm getting paid for 900 patients. If after 2 years, they give you time to build your panel, thankfully, because it does take time.
Yeah.
Um, if after 2 years you don't have 900 on your panel, then your pay will reduce. So that's the way it's set up now. We're hoping that changes because as much as the system, they want the more complex patients to be seeing doctors, is my understanding. That's not what's happening because there's complex patients and very simple, healthy patients all coming to me. And I spend time with all of them. And I do spend a lot of time with complex patients. So we're hoping that eventually they'll start to include that acuity into our funding as well. But I do like the fact that I don't bill per visit because
Mhm.
I can choose to spend 5 minutes if it's something very simple and you're on in a hurry and just need a refill, and I
Right.
can choose to spend an hour with you hearing about you're falling apart and you're overwhelmed and you don't know what's wrong. And trust me, that happens so often. We know as women, as moms, as family members, and that impacts our health. So,
Yeah, no, absolutely. And it all, I mean, in my world, it's a Jenga block. So, I don't necessarily have the expertise from a doctor's perspective, but like the sleep, the stress
yeah,
management, the nutrition, the fitness, like any one of those little blocks that fall that you pull out, the
yeah,
sticks, if they're not if they're not aligned, the house of cards is
yeah. Oh, yeah. Yeah,
it's not pretty. So I can't imagine adding one more facet to that. And I mean, under my umbrella, we're still looking at hormone management, but from a holistic perspective. And never mind adding something like mental health or
yeah,
hormonal symptoms from postmenopause, postpartum. Like there's
yeah,
just so many other facets that are coming through I mean, you've just seen thousands and thousands of uh, new people being diagnosed with adult ADD and adult
hmm,
anxiety and adult ADHD. And, these poor people have suffered for years and thinking that there's something wrong with them, only to find out that, this is maybe just something like something that's wrong that we could fix. These
yeah,
symptoms aren't necessarily something that you have to deal with day to day. And
right.
and that's what I love about when you're talking about, maybe we need to change, and that's for another conversation, how the doctors get billed at the end of the day. And I say this for all of us because you just have to follow the money. I mean, we all do something that we love, but we also do something that we love and we get paid for, which is a
Yeah,
bonus. But at
yeah,
the end of the day, I mean, you have to follow the money. And when it doesn't matter what position you're in, whether you're a doctor under a scope of practitioners that work for a management company, their expectations are that they have to bill and see this many patients.
yeah,
And unfortunately, they're still part of a bigger system,
yes.
whereas you can actually spend some time with your clients. So, how does your front end know to book? Or is it just kind of a throw a dart at the wall and hope that you booked enough time for your clients? So, how does that work? And I mean, because I can imagine that's probably a very difficult situation where you've got a waiting room full of people. You want to spend time with somebody, but unfortunately, at that appointment, you were just thinking it's a prescription refill.
Hmm. So for the most part, I've been fortunate this far because a lot of the visits that I've been doing, there definitely have been sick visits and people, last minute needing something urgently. But for the most part, it's been a lot of meet and greets. And then, we find some things with some people that need addressed right away. But for those meet and greets, because I really want to be, like I said, that GP I grew up there with, um, knowing my patients, I book a lot of time. I've made my meet and greets long, because I want to know the history. I want to hear your frustrations, what you don't want to experience again. And uh, that's allowed me that time. And then my daughter works for me, so we have a great relationship, and she knows when I look at her and tell her I need a little bit of time. She's like, she's very good with people. We have only had a few people have to wait a little bit. They've been very understanding, and I think it's a little bit like when I went to that GP too. You always had to wait a little bit for her, but you never heard anybody complain about it because they knew what they were going to get when they went in. So I'm hoping that's the case for my patients if I get to that point that, but I'm really trying to um, judge even when I tell somebody that has needed more time, when I tell them to come back, I'll tell my daughter, Kayla, I tell her to please book a 20-minute instead of a 10 or that kind of thing, so that I know that I'm going to need a little bit of extra time because this person needs to come in and share first before we address the issue. So,
Yeah, I love that.
yeah.
Well, I'm excited that that we're now having more options with nurse
Mhm.
practitioners, and
Yeah.
ideally being able to get ahead of the curve rather than being, reactive. And you've got people that are going in for something that, obviously not minor when you're going to emergency, but having some options that
Yeah.
we have in the community to be able to go to first rather than just hitting up the emergency and clogging up that system, because that's a whole nother issue.
Yeah.
Okay, let's talk about the how to be advocates. Where do people get stuck in the system? How do we know what to ask for? Like, what are some of the things? Like, can we make an ebook of this? Like, what, how do, what are the questions we need to ask? Like, I don't even know where to start. I mean, I'm really good at that because I appreciate my health, and I need to know if you're putting a drip in my arm, what that drip is, and
Mhm.
what medicine I'm getting, and why, and what the side effects are, and so I'm doing the what ifs with my doctor. So, but I know that because I'm dedicated to understanding more about things that are going into my system or
Yeah.
my family system. But how do you, how do you you can't just have a blanket trust that what they're doing is right for you, because
Yep.
what's I mean, we all know that that doesn't necessarily, we all come to the table with different problems, and even if you're diagnosed with something, it's going to look different and present different than, somebody down the street. So how do we do this? How do we navigate?
I think probably the most important thing to start with is know yourself.
Okay.
Honestly, is to know who you are, um, know your body, really learn it. Know, okay, yes, I'm having a really rough time. Is this because it's a rough time?
Right.
Or is there something else maybe going on?
Okay.
That's important. So you know how hard to push for yourself too. Because sometimes we're super frustrated that somebody's not hearing us. But then a couple weeks, and I've done the same, a couple weeks down the road, if they were to ask me, did you get that figured out? I'm like, what? What did I get figured out? Because it was at that time, right? So I think we have to really learn ourselves what is crucial, what's important to us, and then stick to it. If you were gonna get in a relationship with somebody, you have your like, okay, nope, if they do this or they're this kind of person, not doing it. Have that same kind of thing. If you're going through such and such, I need to get somebody who's going to listen to me. And they're going to have to listen to me. Like they're going to have to hear me. And you don't have to pick it. No, but you do have to say that. Don't be afraid. People My parents were the same. They were that generation where it's the doctor. The
Mm,
doctor said. You don't ask a question, you just do it. And don't be like that. Don't. You know yourself better than anybody does and anybody ever can.
yeah.
And so stand up for it when you know it's the right thing and there's something going on. You might not like the answer you get because sometimes, myself included, you do find out there's something mental health going on.
Mm,
Sometimes it's not physical, but it feels physical. We experience physical symptoms from mental health things. So you might not be happy with the answer, but if you are standing up for yourself, you have to also be open to getting somebody that does help you and really listens. And if there's an answer you don't like, talk it through. Are you sure? Can we check this just to be sure? I think I hesitate when I bring up mental health because I myself have been brushed off when it was something serious. Um, because you have anxiety, you have depression. So I hesitate, but we also have to be open that sometimes there is something there. So don't make your own stigmas on that, right? Um, And then I say, I told the patient this just yesterday, that you had a specialist that saw you for such and such a couple years ago, then you didn't need to go back. Now you have something that's going on again. You need that same specialist.
Mm.
If I put you in the referral system now, you're going to wait. So call the specialist office back. They will tell you it's been this long since you had a visit here. You need a re-referral. Ask
Mhm.
them why.
Yeah,
That doctor knows me already. You already have a chart for me. This is what's happening. If I go back in the system and it is, for instance, skin cancer, and you've made me wait now, how are you going to feel about that? That
right,
put it on people. You yes, there are rules, but what's really going to happen if you bend it a little bit? Because I can see the chart right in front of me. You were here a year and a half ago, but it's supposed to be a year. Right? What there's
yeah,
some things that just don't make sense in the system, so we have to kind of fight back against it. And you won't always be successful, but you got to at least try. And in the meantime, on my end, I'm trying to. I'm
yeah.
trying to push it through. Um, and I think when I got into this funding model, I was number 80. 80 nurse practitioners in 18 months have signed up for this program.
That's it?
That's it. Because it's not what everybody wants, right? It's
Who's everybody?
like it's not what the nurse practitioners want,
Mm.
as far as like I guess everybody's got different lifestyle, different they want full-time or part-time or um, they want more options. And I get it. So do I. I'm 55. I don't want to work all the hours I'm working right now. It's a lot. And it's expected, part of the program. But I don't know. I guess the stage I'm at in my life, I'm not going to make a difference by standing outside of the system and looking in and saying that's not going to work and that's not going to work. I have to be in it and try it at least.
Of course,
Right? To say that, yeah, that part really doesn't work. That's how you're burning out your nurse practitioners or your doctors, which I'm sure is what's happening to a lot of the doctors.
of course.
They don't, I'm sure most doctors do not go into being a doctor to get rich. I'm sure they go in, you put all those years of school and residency and all of that in long days, hours, they do a lot. They don't go into that just to see you for 5 minutes and kick you out the door and not listen to you. They don't, but the system makes it that way. Um, and we have to try to change it. And that's, I mean, I'm just one person, but I'm trying as number 80 in the program. I don't know if there's been anybody since me, but there's so many nurse practitioners out there that probably didn't go into being a nurse practitioner for the type of care that they're providing because the system wasn't letting them bill or get funded care under their scope. And now it is. And I hope more nurse practitioners will try um, and see how it can work for them. And maybe we make a way together to change it, make it a better system for us and our patients. The better it works for us, the better it will be for the patients, right? All of us know that if we're happy in what we do and fulfilled and getting enough sleep, that
Yes.
we're going to do a better job for the people we help. So,
No, absolutely. And I think that the fair model is that if you have your 900 patients and the doctors have their 900 patients, that you're all being paid equally for the same type of job, which isn't happening as you're shaking your
yeah,
head, which is the unfortunate part, because we're all selling time.
yeah,
And I sell time. Like my business is selling time.
Yeah.
So if I'm, I can only sell an hour or 30 minutes at in blocks.
Yeah.
And people aren't willing to pay hundreds dollars for my hour, of my hour of time based on the industry that I'm in and what I'm providing. But and same with you, but we're going to run out of our resource, which is
Yeah.
us.
Hmm.
So you look to build a model, a business model that works for you, that you're not burning out, that you can still give back, that you can still make a difference without putting our health at risk,
Yeah.
which is really the big picture too, because we end up stop looking after ourselves. So
Yeah.
a good reminder as I'm saying this that I'm going to go and do my workout today.
Yeah.
As I have this things to do list that's a
Yeah.
mile long. I'm like, no, I still need to go do my workout.
Yeah.
Okay, and the last question that I have for you is the menopause or perimenopausal women. I do find that over the last few years that we've had more options. So when I first got into this niche in my life for me, and then as well as for my people, I've certainly recognized that I have so many more resources to refer out to for my patient or um, my clients. So I do feel hopeful that that dial has started to turn. I still hear a lot of people, women are, getting angry that, we haven't been researched and we haven't, the World Health Organization did a bad job on a bad study. And, like, okay, yes, I get it, but we have to move on from there. And where we are right now is being aware, knowing that ideally, please, if you're hearing this for the first time, listen, you don't have to suffer through this. There are symptoms that we can correct through medication, through so many options, supplements, through different, healthier lifestyle. But there's so many options for us right now that we never had. The one thing that I want to ask, and it's a bit of you please feel free to disagree, of course, but
Mhm.
in my job, I can't be the jack of all trades. I can't train a 15-year-old and a 50-year-old the same. And I choose not to train the 15-year-old because that's not my jam. I've spent a lot of time in women's health. I love where I'm at in my age, so I've chosen to now incorporate peri and postmenopause into my practice because I'm here. I'm learning, I'm loving, I'm changing as my people are aging as well. So I don't think that I can expect every practitioner out there, NP or GP, to just get on the menopause bandwagon. So if they're not comfortable talking about supplements and hormone replacement, should we be mad that they're not? Should we expect that, every practitioner should be able to talk about every subject?
Yeah, that's a tricky one because really, as a primary care provider, we should be willing to learn it. So
Okay.
that's what I'll
No,
say.
fair. Yeah.
That's our job is, especially nurse practitioners now, if you were even to look into like the licensing, is we are expected to be family all ages. That's
Okay.
that's on our license.
Okay.
Um, and that's the same for GPs. They've been saying, newborns, they used to even be the ones delivering the babies, right? I think some of the older ones still do.
Yeah.
Um, and then right up until the end. And I think it's important that we know all of that. Yes, you may not be a specialist in palliative care, but you should be able to help your patient have a peaceful end
Okay.
if it's that time. And you should be able to at least help. I don't know. I have delivered my own babies, but I haven't delivered anybody else's. But I would hope that I could help them at least through as much as I possibly can at the beginning of life and at the end of life. Um, and I am learning perimenopause. I've already been through it myself and suffered a lot.
Mm,
And everybody thought it was mental health.
mm,
Everybody. Um, including me, because you start feeling like you're going a little crazy.
Yes.
Um, and there's got to be a better way. But I wasn't in a position when I was going through it to go and pay some of the programs that are great that are out there, but I couldn't afford it. Um, and and you get nervous with that kind of thing too, because we've seen lots of different things come and go over the years. Is it a trend? Is it real? Is it right? So I think it's important as primary care providers that we at least know enough if we're not comfortable prescribing, that we know enough of somebody to send them to. And if you are going to be comfortable prescribing, then make sure you learn. And that's what I'm doing now. I have a couple of patients who've already asked me to help them with that. And I was very upfront. I said, I'm learning at the same time as you. So if you learn something, bring it to me.
Right.
And I'm researching as well. And we believe in evidence-based practice. Um, but those women complaining about not having enough research are right. There is
Yes.
not enough research. So not everything's going to be evidence-based. Some of it's anecdotal.
Yeah.
And that's okay too, because we see it even as a nurse practitioner, there's stuff I saw as a nurse. If I said that to a doctor, they'd say that's not how it works. I'm like, yeah, but it did right in
Yeah.
front of me. So I'm good with it. I guess. So
We've seen miracles, we've
yeah.
all seen miracles in our life that don't make any sense at all,
Yeah.
that don't follow any rules
Hmm.
by any research, by any medical textbook, by anybody, anything no anybody knows about.
Yeah,
So I'm going to say that there are things that are outside of all of our scope that
absolutely. Yep.
so I appreciate that. Okay, and I appreciate that you are, just really gave me a good understanding of your, certainly as a practitioner, primary care, what your scope of practice is, because that's important. In my world, I don't dabble in things that aren't in my scope because I choose to be an expert in this.
Yeah.
But at the same time, it's a completely different bird that we're
Yes.
talking about. Okay,
Yes.
so Manchester Rose, this is where we can find you. I will get all your contact information. I'll make sure that we add this to the show notes. At the
Okay.
end of the day, thank you, thank you, thank you for clarifying so many issues that I know that this is bigger than both of us, but I think that the bottom line is all of us knowing are what we can push for, what we need to push for, understanding that we have to start here, that it's not going to end up at your office with that a pill or a prescription is going to fix. We have to start here with looking after what we can control, which
Yes.
is our health and our wellness as much as we can control. And then when things don't feel right, that we've got resources like yourself to go to, and especially somebody who's looking for patients to help with the passion that you have. I can't imagine that you won't be full in months from now. But I will when you are at a point where you need to find some boundaries, so make sure that you're setting them as you're going on for yourself too, because I know that it gets overwhelming, and especially as a new business owner, and there's lots of pieces that you're trying to move forward. So it sounds like you've got lots of great assistance with your family as part of your support system, and most importantly, with your heart that centers
Mhm.
on your patients, which is more than anybody can ask for from a practitioner. So I wish you all the success, and I appreciate your time today.
Thank you so much. I really appreciate it as well. All right.
Okay.